We'll get started. You're looking at a slide. Lower left corner is our historic office building where our business is in downtown Palatine, not far from Elderwerks. This Medicare Made Simple presentation. This is the second time I'm doing this for Elderwerks, and it was created specifically because there is, for some reason, so much confusion out there with people about Medicare and supplement planning, and it doesn't need to be that complicated. I mentioned to Kristen before we were live here that twice in the past month, two pretty educated couples came in with armloads of things. One had been to two other independent advisors like myself, and the other had been to two resources along with a senior center counselor, and they still didn't get it. And that was a perfect example of why I very passionately wanted to design something that was simple for people turning 64, that they didn't have to go through all that. Or if you're already 65, it's still, there are opportunities to make changes and still learn, because people are still walking around confused. So with that, that's why this is being done today. And we'll go to the first slide. So what are we going to talk about today? We're going to talk about general Medicare basics, transitioning from private or group medical coverage to Medicare and a supplement. We're going to talk about enrolling in Medicare, the different parts of Medicare, traditional Medicare supplement options, and something new for those interested in wellness and preventive. This was in the marketing of this particular event, is that this is not a Medicare Advantage seminar or talk. I will touch on it in a few places, but it's something very different than traditional. The people that are on this in this meeting today, I believe you're all here because your interest is in choice and traditional Medicare supplement planning options. So first, what is Medicare? Well, Medicare is a federal insurance program for seniors and other individuals with certain disabilities. And some often confuse it with Medicaid, which is a federal state insurance program for people with limited resources. So sometimes we get tongue twisted and we might say Medicaid when we mean Medicare or vice versa. But Medicare is for the bulk of the population. Medicaid is for those needing assistance. So it was created in 1965, and it's run by the U.S. Centers of Medicare and Medicaid Services. It's primarily for seniors, as I mentioned, and it's been updated a couple times, in 2003, and then the Affordable Care Act in 2010. For more information, many things used to be printed and available for handout. Now the Medicare and You booklet is still available as a PDF or print. The Choosing a Medigap Policy booklet is only available in electronic form. And we can send links. We'll be later sending a link to reach us for any communications you need, and we could provide you with these items if you need them. But I'm going to bet you're not even going to care about them when you're finished with this simple talk. That's my hope. So there's different parts of Medicare. There's A and B, which constitute what's referred to. You'll see the terms original Medicare. Part C came out when Medicare Advantage plans were born. Medicare Advantage plans don't actually involve being in Medicare. And there's maybe proposed legislation to get that word out of there. Personally, I can't imagine someone paying into the Medicare system their entire lives and being eligible for Medicare and then wanting to do what happens in Part C. And that's where you assign your Medicare benefits over to the insurance company. So now there's no longer Medicare paying the 80% and the supplement paying 20%. Now the insurance company is in control of everything. And at this point, I think I'm going to stop just a moment and say, before we go any further, I want you to clear your mind of everything you know or think you know about Medicare and supplements. If you can see my hands here, I'm holding up like a big loaf of bread. That represents Medicare. Medicare pays 80%. And then a smaller loaf of bread is the supplement. It pays 20%. There's a small deductible for non-hospital services, and everything else is covered at 100% if using doctors that accept Medicare and hospitals that accept Medicare. And that's all you really need to know. I got to show you the in-between stuff because it's prudent to show you. But if you can just keep that in mind, Medicare pays 80%, the supplement pays 20%. And there's a small deductible before physician's charges on the 20%. So kind of keep that in mind as we go. So there I mentioned Medicare Part C, Advantage plans. I should use my mouse here, my little arrow. Part D is prescription drug coverage. Years ago, before supplements were standardized, drug coverage was included in plans. Drug coverage is included in Medicare Advantage plans. But when you buy a traditional supplement and have Medicare pay the 80%, we do then recommend, because there's penalties involved, people have a prescription drug plan. So when should we enroll? Well, if you or your spouse are currently working and you have health insurance through an employer, you do not need to enroll in Medicare at 65. Get a lot of calls about this. There's a lot of confusion. Employers don't know what to do. They don't need to do anything, but sometimes they take a look at the rates of a 65-year-old on a group plan, and they offer some opportunities for someone 65 in the workplace to say, well, if you'd like to take a look at Medicare, maybe we'll compensate you for that. So, but it is not required. So you or your spouse working, have health insurance through an employer, you don't need to do anything. When you or your spouse retire, regardless of age, not working anymore, you'll have a special opportunity to enroll in A and B then without penalty. Why is there no penalty? Because you were actively employed elsewhere and you had your benefits and you weren't asking the government for anything. If you need medical coverage for your spouse and your family, this is important to know. Medicare won't cover family members unless they qualify on their own. How would they qualify? Well, they need to be 65 or older, or under 65 and disabled, or a disabled child, right? So if the spouse is under 65 and the other spouse is turning 65 or coming off the plan, they would need to maintain a separate or individual group coverage to 65. So same for a dependent child. So keep that in mind. So Medicare alone may not be enough, and that's why we're talking about the options today. So Medicare A and B, that jumped up back, please. Medicare A and B have no yearly cap for out-of-pocket expenses. So that's why Medicare alone is not enough, because that 80% leaves 20% hanging. Right? So the options are original Medicare, and a Medicare supplement. Then privatized Medicare Advantage plans. Why do I say privatized? It's because Medicare is not involved anymore. Medicare allows the funds that have been sitting there and being paid in by us, for our lifetime. Well, they allow those funds to be, and pretty big chunk as well, allow them to be assigned over to the insurance company, Blue Cross, United Healthcare, whoever it may be. And that's why it's considered privatized, because it's not Medicare anymore. So I really wish they would take that word out of there. So then privatized Medicare Advantage plan, that's an option. The prescription drug expenses are built into Medicare Advantage, but they're separate, as I said on a prior slide, when you buy a supplement. And make no doubt, Medicare supplements and Medicare Advantage plans are not the same. So enrolling in Part A, let's talk about that. People are automatically enrolled in A if they're receiving Social Security benefits and you turn 65. That's automatic. And most Medicare enrollees pay no costs. So if we've worked 40 quarters in this country, 10 years, and paid in FICA taxes for Part A, there's no cost. If we don't enroll in A when first eligible, there's a penalty, and that can increase by 10%. So we want to stay on top of that. And first eligible could mean no longer working and covered by a health plan. So if we're not receiving Social Security benefits at age 65, we should sign up for Part A, contact the local Social Security office. You can go online, ssa.gov, crossing fingers that it works, because it's no two cases are alike. Some people say they're told they need to come in. Some do it online successfully. Some do it by phone. So leave a good amount of time there to do that. But consider delaying enrollment in Part A if you're working, because you could be working for an employer and go ahead and enroll in Part A. It's free, and why not? But do not enroll in Part A, I suggest, if you're contributing to a health savings account through your employer or have a high deductible HSA plan, and that is you don't want that to be not tax deductible, because that's considered double dipping, because Part A is immediate 100% coverage for or coverage for hospital, and the government considers that double dipping. So you can disqualify yourself from the pre-tax benefit of a health savings account if you enroll in Part A and wanted that fund to not impact taxes for the year. So enrolling in Medicare A continued. If you go back, please. If you decide to enroll in A, you can sign up during these following times. Got an initial enrollment period, general enrollment period, and a special enrollment period. And let's go to the next slide and we'll see what that means. So left here, left, initial enrollment period. So this is now, there's a 7-month window when people can first enroll in Medicare Parts A and B. So it's 3 months before our 65th birthday, our birthday month, and 3 months after, and that equals 7, right? Below that, a special enrollment period, and that can be triggered by something unique that lets us register without a penalty. Our insurance is ending, a change of address, move out of state, current Medicare plan changes or ends. And then over to the right, general enrollment period that occurs January 1 through March 31. During this time, people can switch or leave a Medicare Advantage plan as well as enroll into Medicare. But depending upon your circumstances, there can be a late enrollment penalty. So that's case by case. So enrolling in B, I mentioned if you're receiving Social Security benefits, you're automatically going to be enrolled in B in the first day of the month you turn 65. So open enrollment supplement is the 6 months following enrollment in Medicare B. So you enroll in Part B, you have then 6 months. We're talking now the supplement. You have 6 months to buy anything you like without any medical questions asked. Once we go beyond that 6 months, we then would have to answer medical questions with most all companies, with the exception of one. So we want to be careful about choosing wisely during that period of time. There are some exceptions that we'll cover later, but the 6 months following enrollment in Medicare B is a very important time. So if we're still working and receiving Social Security benefits and you don't wish to enroll and pay for B, because there is a cost for Medicare B, and you get the card anyway because you're receiving Social Security, so the card comes in the mail, that red, white, and blue card, you can make plans to return it so that you're not paying for B. We'll talk about that. Enrolling in B continued. If you did not sign up for B when you were first eligible, you could sign up during general enrollment, special enrollment. If you're 65 or older and enrolled in B, wait, we just repeated this. Nope, the 6 month, like the prior slide. You have the 6 month open enrollment then, which gives you that guaranteed right to buy any traditional supplement. I said those words on the prior slide, but this is a different one. So and again, that very important 6 months period of time following enrollment in B.
This is the initial
enrollment periods. Top right, we have the general enrollment period for B now, occurring January through March 31. This is a time when you can switch or leave a Medicare Advantage plan as well as enroll into Medicare. And again, there can be late enrollment penalties depending upon your situation. Special enrollment period triggered by unique circumstances where you can register without a late penalty. And again, alternative insurance ends, changed address, moved, Medicare plan might have been discontinued. So let's take a look at the 2026 Medicare costs. And when I want to have you clear your minds of something else here, I changed the word. This is a document that's been reproduced from something that the government puts out. And when I sit down at the conference table with someone, I use the actual document, and the government has interchanged the word costs and premiums to where it's very confusing. So what I'd like you to do is clear your mind of what the word cost and premium means. And for today, when I use the word costs, unless we didn't catch one of the changes, when I use the word cost, I'm going to be referring to the government Medicare cost. When I use the word premiums. I think we're all familiar with talking about medical insurance premiums, homeowners insurance premiums, auto insurance premiums, etc. So when I'm talking about premium for insurance, I'm going to use the word premium. So keep that in mind. Let's go back for a refresher. Medicare pays 80%. The supplement pays 20%. There's a small deductible for non-hospital services. We're going to use the word cost when we talk about government charges. We're going to use the word premium when we talk about insurance premium charges. And if I miss the spot here, we'll catch it on the next run. So here we go at the top. Medicare A does have a monthly cost that most people don't pay because they've worked 40 quarters in this country. But if you haven't, and I have had some people come in that situation, they can buy in for $565 a month, which is the rate for 2026. That's just for A. If you don't enroll in A when you're first eligible, when you turn 65, we talked about already, there could be a penalty. For B, there is a monthly cost for everyone. Most people pay the standard Part B monthly cost of it's $202 a month per person in 2026. If one person is 65 and the other person is under, then that under 65 spouse is not going to pay until they're enrolled in Medicare. So the $202.90, you might be paying the 2025 rate because it hasn't gone up yet, but for 2026, it's going to $202.90. Social Security will inform you of the exact amount based upon your income. And so you'll pay that standard cost if you enroll in B for the first time, if you're directly billed for Part B premiums, or if you've got Medicare or Medicaid paying your premiums, the state will pay that standard cost of $202.90 in 2026. Now that's the standard cost, and we go to the next chart and we'll see that it's based upon income. It's based upon, we're talking about Part B, not talking about insurance now, we're talking about costs. So we're referring to the government cost. So we have to pay. A is free for most of us, but B has a cost that's based upon our income. You're seeing the date of 2024 in the middle of the screen there, and at the top, this is not an out-of-date form, pardon me. It is just that the 2026 rate that we'll pay is based upon looking back 2 years to the 2024 income. So that top line, if you're an individual and you're 109,000 income or less, all the way to the right, cost is going to be $202.90 per month. They'll either bill it to you or it can come out of your Social Security check. If you're married or and filing a joint return, it's the amount is 218,000 or less. Going to the right, that family each would pay that are over 65 and enrolled in B $202.90. You can see, I won't read all these numbers to you, but as you can see, the income brackets go up. And the top for someone making 750,000 above as a couple would be as high as $689.90. Although if they were making 750, they could afford it, but they still don't like to pay. And I understand. So this does change most years with inflation and the CPI. So it's not static. There was years and years where it was relatively the same. But so this is a chart for 2026. There's also a cost for the drug plan. And this is going to be not the drug plan, but to enroll with Medicare to have a drug plan. And this chart below reflects different rates. So there we are at that 109,000 or less. And if you go to the right, you only pay your plan premium. So the government doesn't charge us if our income is 109 or jointly 218 or less. We won't pay the government for Plan D. We'll only pay the premium. If we're in that next bracket, it would go up to $1,450 cost plus our premium, and so on and so on. Down to the bottom, $750 or above would be $91 plus the plan premium. No, we haven't talked anything about insurance costs yet. We're only talking about Medicare costs here. So we haven't talked about insurance premium. That you would do if you sit down with somebody like me and you ask for specific quotes for a plan for you based upon your age, your zip code. So today we're talking about the government costs. Next slide. Here we have the world of Medicare supplement plans. Initially, they were A through J, then there was modification, and now we're looking at Medicare supplement plans that can be purchased, not from all companies, because all companies are not required to carry all plans. But if you buy, for example, a Plan G, which is the going plan, the most popular plan now, if you buy a G from Blue Cross, United Healthcare, Physicians Mutual, Humana, the government, when they standardized these plans, they said all the core benefits must be identical. But you say, they're different prices. How can that be? Well, this is America. Companies can charge what they need to charge based upon their loss experience, their profits and losses. They can add extra things. They could add discounts or health club memberships or other, we call them bells and whistles. Excuse me. So I'll draw your eye here to the left. We see that there's a B, C, D, F, etc. And to the left is a little explanation of what's there. You might see, now, unfortunately, here's a little more confusion that I want to unravel. We've talked about Medicare A and B. We've talked about Medicare C, which is Medicare Advantage. And we've talked about D, which is the drug plan. But that has nothing to do with this chart. I wish they would have called them apples, oranges, or give them animal names or something, but they didn't. They went ahead and called Medicare A and B. Medicare A and B was already A and B, but when the supplements were standardized, instead of using something else, some other code or a color, now here we go. Now there's A, B, C, and D. So that right off the bat, this is confusion. So what we're looking at here is Medicare supplement insurance plans, not the Medicare piece. So clear your mind. We know that there's Medicare A and B. You enroll and pay for it, but A is free, B has a charge. We know C is Medicare Advantage plans, but that is not what was reflected. That is not what is reflected on this chart. So I hope that helps. The most popular plans in the past, if you turned 65 before January of 2020, Plan F was a plan that many people went to. However, I'm going to share with you that I had very few clients with Plan F, because if you move your eye over to Plan G, you'll see that this is for 2026, there's a deductible for Part B of $283, but that's the only difference between F and G. But there was hundreds of dollars of difference in premium, the insurance premium. So I would always look at a $400 or $500 savings sometimes versus 283 or whatever the deductible was that year, and say, would you really like to spend $500 to insure 283? Most people are investment oriented like I am, and they'd say, no. When a couple comes in now in their mid to late 70s and they have an old Plan F, because if you bought a Plan F, you can buy another Plan F if you were 65 before January 2020, but you can't buy one if you were 65 after. But someone with an F could come in and say, hey, would you shop this out for me? They could get another F. But when I show this mid 70s to late 70s couple G versus their old F, there is $1,800 to $2,000 difference. So that's crazy. So I don't have anybody with an F. I don't think there's anybody out there in my world with an F. So there's F. Moving over, FHD, that stands for F high deductible. Let's take a look at G right now. You can see the G checks all the boxes, and it has the $283 filled in the box. And next to that, GHD, that stands for G high deductible. What's that? Well, if you take your eye down to the highlighted text in the second line, you'll see that there is a $2,950 deductible there in 2026. It's not for hospital, it's for Part B, and that's what a GHD plan is. And so it is less premium, but it is something to talk about. Slide. So Part B benefits, let's kind of take a peek at that. Part B benefits include a welcome to Medicare visit, but nurses and doctors, and if you're over 65, you'll see that it's not really much of a exam. It's not really a physical exam. It's kind of a touchless exam. They'll touch you with the blood pressure cuff and ask some questions, but it's pretty much, I had a doctor tell me this, kind of data mining. It's to get the diagnostic codes so that they can properly bill and get paid by Medicare and the supplement, but it's not really a comprehensive physical exam. There are some preventive services that we'll talk about. Part B benefits are inpatient, outpatient doctor services, surgical services and supplies, speech and physical therapy, diagnostic tests, medically necessary, durable medical equipment where medically necessary, and ambulance services. So that's kind of a nutshell what's under B. Under the preventive, that welcome to Medicare visit, it's a kind of a one-time review of your health, but it's kind of quick, down and dirty, and they'll just touch you with the blood pressure cuff. There's no checking you for swelling or probing your abdomen and tummy and all that. They just don't do that anymore. And they say that we don't do that. So it's education and counseling regarding preventive services, maybe, but be a smart consumer when you go to that exam and just speak up and ask your questions, because it is, when you first turn 65, you must complete that within the first 12 months of your be effective date, but it is not a physical exam. Then there's an annual wellness visit, but it is really not a physical exam. It's just to develop and update those diagnostic codes so that they can bill Medicare and maybe talk a little bit about prevention, refill prescriptions and such. Provided free one time every 12 months. It's not subject to that Part B deductible. But once again, it's not a physical exam. If you want a physical exam and you have a traditional Medicare supplement that does not have the special rider that I'm going to talk about, that only one company has, you may be billed out of pocket for this. So preventive services, let's get into that a little bit deeper. Medicare can cover some, but not all for preventive services. Doctor might recommend things more frequently based upon a schedule. There is a abdominal aortic aneurysm screening. You've probably heard of them if you've ever had a Lifeline screening. But Medicare will pay for one of those, one time only. Mammogram every 12 months. They tried to knock that out and do it every 2, and it's back now for every 12. Blood test for cardiovascular disease every 5 years. Personally, I think those expanded tests for cardiac markers should be done every year, and there is one plan that does cover that, but in general, Medicare does not in general, Medicare does not, that's firm. And the other supplements don't, there's just one that does. Colonoscopy, I think this is crazy. If you go in for a colonoscopy and you don't have a polyp, they're gonna tell you to come back in 10 years. Well, what if you got a polyp the next year? Then we let it grow for 9 years and turn cancerous, and because we can't go back for 10 years. So again, there is one plan that will cover it. Not that we like going in for colonoscopies, but there is one plan that will let us go in more frequently for screening colonoscopies and other screening services. And then there's flu shots. So that's kind of it on the preventive there. Medicare A, we're going to talk about what's covered under Medicare A by Medicare and Plan G or N. So now we're going to talk about Medicare in the middle, and we're going to talk about what the insurance picks up. But I want to hold up my loaf of bread again. Medicare pays 80% and the supplement pays 20%, and you don't really need to worry about any of this, but yet you should know it, because this is how it's working on the inside. But you drive a car, but you don't necessarily know how the motor was built either. So, but I'm just going to tell you a little bit here. Here's the details on plans G and N. So every year there is a deductible for hospital. And guess what? Medicare pays nothing of the hospital deductible. So it's important that we have a supplement. If you have a supplement, it's going to pick up that $1,736, which is the 2026 deductible for hospital, and the patient pays $0. For 60 days in the hospital, again, we're still talking 80-20. You don't really need to know this, but inside, this is what's happening. Medicare pays all but $1,736. The plan picks up the $1,736. Patient pays $0. 61 through 90 in the hospital. We've got to be pretty sick, but we have seen long hospital stays with long COVID and some other things. So it's there. Medicare pays all but $434 a day. Plan picks up the $434. I think already you're seeing, boy, if I didn't have a supplement, I'd be picking up these charges here. And by the way, that deductible for hospital is not just one time a year. It's if there's 60 days in between and you go in the hospital again, it's another deductible. But do you pay? No, there's a zero to the right. Medicare is going to pick it up. That can happen. It could happen 4 times a year. So 91 through 150, we must be very sick. Medicare is paying all but $868. Plan picks up the $868 and we pay $0. Now we're looking at something called extended hospital coverage. What is that? Well, that's up to another 365 days on top of the 150 for life. Guess what? Medicare pays nothing after 150 days. If we don't have a supplement, we would be responsible. However, the supplement, when it says plan pays, this is regarding the supplement insurance. Insurance pays. Maybe I'll change that to insurance pays. 100% of the eligible expenses. And so far, per hospital, we have no out-of-pocket because that far right column has got zero. It's all the way down the line. How comforting is that? Take a look at the next slide.
Next slide.
Yeah. Oh, I got, okay. Then they break out a benefit for blood. Medicare pays all but 3 pints and the plan picks up the 3 pints and we pay zero. Skilled nursing facility. This is not to be confused, and this is the time I'll mention, this is not to be confused with long-term care. This is if we need skilled care for wound care, pain oversight, rehab because of a fall and a maybe replaced hip or knee, something like that. Covers the first 20 days at 100%, and the plan picks up nothing because it doesn't have to, because Medicare is paying 100% of the first 20 days and we pay zero. Skilled nursing facility continued when we get into 21 through 100 days, then it's doing the 80-20 thing there. Medicare paying all but 217 and the plan picking up the 217. But note that the word skilled is there. This is not for custodial care or I need a sandwich or someone to sit with me and make sure I get to the shower safely. This is for professional skilled care. If we had a stroke, for example, and we're at day 41 and we're not showing any signs of improvement, we're no longer in need of skilled care. We're now in need of perhaps custodial care, companion care, or what's called long-term care. And this payment stream here is going to stop from Medicare and the supplement, and we might be transferred to a nursing home and paying on our own. So this is the time I'll mention that I also do frequent talks for Elderwerks on long-term care planning and funding, and one is coming up in 2026. It's going to be February 10th at 6 o'clock, and we can send you a link on that down the road. This is a slide that I have in one of those presentations, and it's because 50% of the people I'd say that come in for Medicare supplement planning mistakenly think that long-term care is now going to be covered. And it's because of this area here, because of that first 100 days that we talked about on the prior slide, and days 0 to 20, 100%, and then 21 to 100, it's 80-20. But again, this is only for skilled care and prior hospital stay required and lots of other rules and regs. But down the line here, you can see for assisted living, continuing care, adult day, limited home care, not covered, not covered, not covered. Private Medigap insurance, this is a government form that used the word Medigap synonymously with Medicare supplement. And you can see it's referencing the 21 through 100 days for that skilled care, but for everything else, not covered, not covered. There's a reference to Medicaid there. I am not a Medicaid expert. There are, through Elderwerks, very experienced elder law attorneys that can help people in that space. And I stay in my lane when it comes to that, refer to them. But in a nutshell, one qualifies for Medicaid when they've spent down to the last $2,000. And you don't want to be in that place. In Illinois, we are an Illinois partnership state, something I talk about in my long-term care educational talk, that if we even have a small plan in place, Illinois being a partnership state lets us retain assets because we had a long-term care plan in place. So that's for another discussion, but there's just an advantage to having long-term care plans in place when it comes to maybe not being the wealthiest, but because we saved the state on the front end some money, they let us hold on to some personal assets on the other side of the board and not have to spend down to 2,000. The last column is pretty much where many people are that don't have done long-term care planning before the crisis, and that is for us to pay on our own or go to Medicaid. So it's a shock. Yes, personal medical insurance and Medicare don't pay. No. Personal medical insurance, group coverage, Medicare and Medicare supplements never pay the cost of non-medical care. Sometimes it's good to hear things 2 times and in 2 different ways so that we don't forget. Medicare may pay for short-term care up to 100 days maximum, as you saw, but only if skilled care is needed. And that's for rehab or pain management, wound care. and is a medical necessity, but Medicare never covers the cost of non-medical, long-term, or extended care. Important to know and remember in your planning. So let's take a look at Part B now. So Part A was hospital, Part B is everything else. So here we have the word deductible to the left, as we saw on A, and we see that Medicare doesn't pay anything of the deductible. The plan G also doesn't pay, because remember you saw that chart, the world of Medicare supplements, you saw the only box that didn't have a check mark, and that was the Medicare B deductible, and that's right here. So we will pay that $283 deductible for Part B, not for hospital, but for all other. And that's not counting all the things that are preventive and paid at 100%. So this is really going to be sick visits out of the hospital. I've got a sore throat. I hurt my back. I'm going to the orthopedist. These types of things. That deductible is paid only once. How does that work when you go to the medical office? Well, you give your Medicare card and your supplement card, but you don't pay anything that day. Why? Let's say that $200 charge happens that day. You let the medical office submit that to the insurance company, and now there's going to be a discount calculated because there's a Medicare scale, there's a Medicare agreement, Medicare pricing agreement between the doctor's office, who says they'll accept people on Medicare, and the insurance company. So let's say that $200 charge turns into $120. Now, you're going to not pay that $200. You're going to pay that $120, and that's going to chip away at that $283. Maybe there's a $500 visit. It gets chipped down to $300, and it's going to be all taken care of just with one visit. But after that, everything else for the rest of the year is 100%. 80% Medicare, 20% the supplement. You paid the deductible, and now we're talking no out-of-pocket, nothing to worry about, no co-pays, no excess billing, unless you're talking about cosmetic or something that you decided to do on your own. So after that deductible, it's pretty much 80-20. It says generally, it's not generally, it is. It's 80-20. After that deductible, Medicare pays 80%, the supplement pays 20%, and there's another zero. Plan N was, oops, I did that. Plan N was mentioned, and I'm just going to explain that real quick. It is a little bit less expensive than Plan G, but I don't have anybody that's ever enrolled in it, and I'll tell you why. It's the same 80-20, same $283 deductible, but this one has, Plan N does have a $20 office visit copay and a $50 copay for VER. Now that's not so bad if the premium savings were substantial, but here's the facts. There's what's called excess benefits with Plan G. And for excess benefits, and I'll explain what that is, Medicare pays nothing. But the plan picks up 100% and we pay zero. With Plan N, Medicare pays nothing of the excess benefits. The plan pays nothing and we pay everything. But what does that actually mean? If you have a pen and paper, you can write this down. In Illinois, doctors who don't accept Medicare that you might go to can or still have some restrictions on them. They can bill no more than 15% over the Medicare scale. So 15% of $100, no problem. 15% of $1,000 might not concern you. But what if we were talking a cardiac thing where you had gone to an out-of-network of a doctor that did not accept Medicare, and we all know that there's some out there, and you went to the specialist, and maybe it was a cardiac event, and it was a $400,000 thing. Well, then you're looking at 15% of $400,000. And most people turning 65 are looking for certainty, not wild card. And the savings is so small. If you sit down with me or someone like me, you'll see that the difference between G and N is not, it might be $40 or $50 or something, but it is not worth taking on that unknown exposure. So that's what N is all about. It's the closest thing to G, but it has copays and it has this excess benefits that's not covered. So if you're with a G, you're still seeing zeros to the right. There's a benefit for blood broken out, all but 3 pints. The plan pays the 3 pints, we pay zero. Then we get into emergency care outside of the US. Let's go back. Emergency care outside of the US, notice that Medicare pays nothing. You leave the country, you plan on leaving the country, you call me or someone like me, or make plans with your travel agent and make sure it's a comprehensive, make sure it's not just lost luggage and trip cancellation, that it is comprehensive medical coverage to coordinate with what Medicare doesn't pay, because Medicare is paying nothing outside of the country, not a dime. You have Plan G will pick up 80% after a 250 deductible, but only to a maximum of $50,000. I've talked to people that told me about evacuations from cruise ships costing $50,000 just for the helicopter ride. So you've got to have global coverage, and it is available. It's not terribly unaffordable. There's an 800 number. They speak all languages. Coordinate your care. God forbid somebody dies, needs an evacuation. Transportation of a body out of a foreign country can be very costly and very, very challenging with lots of steps involved. So it's like having your own little embassy in your pocket. So it's very important to have this additional coverage and know that Medicare is not paying anything outside of country. So why do we need global coverage? Because Medicare pays nothing for emergency care outside of the US. Some Medicare supplements have a separate foreign travel deductible of $250 and then pay for that 80% you talked about. But we pay 20% and anything beyond the $50,000. So global medical, using that as a general term, pays what Medicare and the supplements don't pay. So it coordinates. It pays what your supplement doesn't pay. Okay. What else does Medicare not cover? Medicare and Parts A and B of Medicare don't cover routine dental, vision, hearing, or foot care, long-term care, as we talked about, healthcare outside of the US, alternative care, although there is a plan that covers things that are not excluded, that are being excluded here, that won't be excluded on something else, but for purposes of today, no alternative care, no elective cosmetic surgery, not personal care, drugs, because we talked about those are covered under Plan D, and non-medical expenses, and also don't cover many preventive health screenings that can be covered elsewhere. So in a nutshell, as we talk about this, I'm going to touch just a little bit on Advantage plans. It's not an Advantage seminar, but once enrolled in an Advantage plan, people are removed from original Medicare A and B, but they still have to pay for it. Why? Because the benefits are being assigned to the insurance company and it still has to be paid for. So your Medicare benefits and decisions are going to be assigned to the selected Medicare Advantage insurance company. And again, they should take the word Medicare out of there because it's not Medicare anymore. So the red, white, and blue card is no longer part of your life. And they have finally banned anybody advertising from showing the Medicare card on the TV advertisement when there's no Medicare in the plan. So Medicare Advantage plans are private plans. They are not supplemental insurance. They're one package. They're using your Medicare benefits, but they're calling the shots. And there are some guidelines for, certain people with certain levels of income. Maybe that's all that can be afforded. But if you value choice and you can afford a traditional supplement, this is where most of my clients evolve. So they're with Advantage plans. It may involve network restrictions, can be limited by county. The networks can change anytime. I'm not trying to torpedo it. I'm just telling you that if you haven't enrolled in anything yet, these are the restrictions that are being maybe even more restrictive than your group coverage that you have now. Doctors, hospitals, and networks can change any month, any time of the year. So you could have a doctor in a network, in January, and 2 months later, their contract comes up, which has nothing to do with our calendar year deductible and enrollment, and the doctor and the hospital are out of network. I'm getting calls from people now that their Aetna is no longer being accepted by Endeavor, and their Advantage plan is no longer working for them. So they're moving over and coming on a traditional plan. So out-of-pocket costs can change anytime. Purchasing a Medicare supplement to cover extra costs and provide access to non-network doctors is prohibited. So you can't have an Advantage plan for free and say, oh, could I maybe take a high deductible supplement just to back me up? You can't do that. It's not allowed. So they're not Medicare replacement plans. They're not supplements, and Medicare is no longer the 80% loaf of bread. So this is something my cousin received. She was turning 65. She's in Southern Illinois, Girard, Illinois, 30 miles south of Springfield. She got this letter because she was nearing 65, and Mayo Clinic wanted to let her know because my cousin is she survived cancer, breast cancer, was treated at Mayo. But they wanted to let them know that Mayo Clinic is not in most Medicare Advantage plans, and further said that if you ever want to even schedule an appointment, they won't even schedule. So same would hold true probably Cleveland Clinic. I have a couple clients that sought the help of Cleveland Clinic for some cardiac issue. Cleveland's not that far away, and they've got some specialists there. Same with MD Anderson Cancer Institute. So these institutions just don't accept too many Medicare Advantage plans. And if you want the freedom of choice to have anything you want and need as as time goes on, there's something else worth mentioning that I'm part of the MIT Age Lab Planning for Longevity Advisory Network. And scientists there are predicting that in the next 5 years, maybe less, we're going to see 3 centuries of progress in predicting and preventing illness. And how are we going to pay for these things if we don't have plans that allow us freedom of choice to go get these preventive screenings? And there's just a whole lot of considerations along with that. But can you imagine 300 years of progress? And you see it now. You see how rapidly new technologies are coming through our phones and in the news all the time. So just something to think about. We're in a very interesting time of life where many have seen the first TV, the first color TV, and first, walk on the moon, and also maybe seeing cures for things like diabetes, cancer, Alzheimer's, who knows? But I think a lot of good things are on the horizon. But we want to have a health plan that gives us a choice to be able to seek out these treatments, in my opinion. So just kind of a quick look at a supplement versus advantage and how things are treated. On the left, you can use any doctor or hospital that accepts Medicare anywhere in the US. It means if you're traveling and you need care, you're always covered. You buy a Medicare supplement, traditional Medicare supplement, they're forever plans. You can keep them forever and they work anywhere. On the right side, you can only use doctors who are in the plan's network and service area generally. In most cases on the left, under a supplement, you don't need it. I don't know of any case where you need a referral, but this is a compliant document here, and you don't need a referral to use Medicare approved physicians and providers. With an Advantage plan, you need to get a referral for just about everything that's not general medicine. You do pay an insurance premium for a supplement, but many of the Medicare Advantage plans have no or low cost premiums, but they do have copays for specialists. They can be, sometimes I've had people tell me for ophthalmology, $75 to $100 an encounter. And the gal that does the billing at a local ophthalmologist said that some people are reluctant to finish up their treatment because they've got a scratch on their eye or an eye infection. They get prescribed drops, so there's 75 for the first visit. Now come back in a couple days and let me see how the drops are doing. That's 75 for the next visit. And come back and see me in a week and let's make sure the infection or scratch is healed. That's another $75. So then you have charges for hospital days that can be hundreds of dollars for so many days in the hospital. So oftentimes people are seeing that out of pocket of, $9,000 to $13,000 there. So where's the savings? Plus no choice. I don't know. It's just personal choice, but I teach, you decide. In most cases, there's no requirement for a service or supply to be approved ahead of time with a traditional supplement, but in many cases, you need pre-approval before receiving certain drugs or services. Also, this is really important. On the Medicare supplement side, we find the best drug plan that suits the needs of the particular based upon zip code, drugs being taken, and location. But when you're on a Medicare Advantage plan, there is a built-in drug plan, one size fits all, that may not be best for every person. So there can be some out-of-pocket costs there as well. And did you know, this is important, did you know that if you've enrolled in an Advantage plan, there is a one-time get out of jail opportunity? Those are my words. While test driving a Medicare Advantage plan for the first time. So your trial rights, so if you're enrolled in an Advantage plan when you're first eligible for Medicare, or you dropped a Medicare supplement to test drive an Advantage plan for the first time, you have up to 1 year to get out and enroll in a traditional Medicare supplement, get back in Medicare without any medical underwriting. So no medical questions asked and you won't be denied. After that 12 months window ends, you lose that guaranteed issue opportunity unless another qualifying event pops up, like moving to another state. That plan is, of course, not in the other state, or moving to another county. Sometimes it can happen like that. Or maybe there's a divorce and you're left on your own and that plan is discontinued or whatever the case may be. But so one time get out of jail. So that first year, if you don't like it and it doesn't like you, then you can, reach out and look into getting out. They say that the average income of the people that are enrolled in the Advantage plans is about 35,000 a year. And I understand that someone with limited income might not be able to afford anything else, but the out-of-pocket costs can far and exceed the cost of a traditional Medicare supplement, where at least you know what you're facing and you don't have to fight to get a specialist or use any particular hospital. Let's talk about the prescription drug coverage here. Prescription drug coverage is an option run by private companies that are approved with Medicare, and they help cover the cost of prescription drugs. They cover brand name and generic and everything in between. And having a plan helps lower the cost because they're discounted rates given to the insurance companies. Doesn't cover non-prescription drugs. Limited on the weight gain and weight gain and loss drug products. Update for the GLP-1 status may be covered for medical reasons. There's type 2 diabetes, any cardio risk issues of chronic obstructive sleep apnea, things like that. And the criteria is being reduced in 2026. So more people on Medicare may be able to get these drugs. This is not a opinion on the taking on the risk of GLP-1 or not. It's just letting you know that it's better situation now. So Part D, non-prescription drugs, weight gain or loss, fertility, cough and cold remedies, over the counter, hair growth or cosmetic, and most vitamins and minerals. There are some supplements that might be medically prescribed, and those are considered case by case. So I'm a visual person. I like to see the drug plan world in a visual form here. So we now have for 2026, we're looking at a $615 annual deductible in orange and blue there. Is everybody going to pay $615? No. If you only have drugs that cost $10, then you won't pay the $615. It's just that the first $615, if you have drug costs that exceed $615, the $615 is the deductible that's satisfied first. After that, in the gold, yellow, we pay 25% up to a maximum of $2,100 for 2026. Prior to 2025, that number was much larger, but now as of 2025, it was capped at 2,000. Now it's 2026. And so that catastrophic coverage begins, and there's no additional costs for drugs once you reach that $2,100 out of pocket. So that's kind of good to know. So they called this a donut hole before. It never was a donut to me. It was a U, and now it's an L. So I don't know where the donut came from, but anyway, next slide. This is how coverage works. So there's your deductible up to $615. That's the amount you pay before the plan, the supplement or the drug plan supplement would pay. Then there's that 25% piece, then the catastrophic piece. So we'll pay 100% of the $615, maybe 25% of the next up to $2,100 out of pocket max. It is possible, and a lot of people come in, they could be on statins, blood pressure medication, thyroid things, a host of other things, and the cost of the drug plan insurance is actually zero. And some of the drugs are actually zero cost. So it depends on what category they're in. So be a wise shopper and ask for generics when possible, and be aware. The doctors have these charts right in their rooms, their exam rooms, so you can kind of see that with them. Special note for those taking insulin. Approved insulins are no more than $35 for a 30-day supply until they reach the catastrophic phase. That insulin does need to be on the plan's formulary list of drugs. So again, have that conversation with the doctor, make sure, hey, is this a formulary? Is this on the formulary? Insulin through an insulin pump also has a $35 max copay, which goes through Medicare B, not the drug plan. So there are some things like in-office infusions, some things we find are not covered under the drug plan, but they are covered under Medicare Part B. So always, have a conversation about that if you have some questions on that. Okay, late enrollment in D, we have to talk about that. Some people aren't taking any medication and they turn 65 and they buy a supplement. And a couple of years ago, it seemed like all of the drug plan insurance plans had a cost. They were about $15 to $35 a month. Now there's so many that are no cost. But when people who are taking no medication enrolled in Medicare and the supplement and talked about the drug plan, some people refuse. And like, I'm not taking anything. I'm not going to enroll. And I would always tell them this, but some people insisted that there is a penalty. It's not just a one-time fee. If you don't enroll in a drug plan when you're first eligible, do I mean while you're working and covered under a group health plan? No, I don't. I'm talking about when you enroll in Medicare B, you've got Medicare and a supplement, you got to enroll in a drug plan or you have a penalty. And it will be added to your drug plan cost each month. And it's calculated using the amount of time you went without coverage. And I have someone that went without coverage for 20 years. She could afford it, but she had no medications in her world. Then she had a stroke, and now she's on blood thinner. And so 20 years later, she got penalized for every month that she was not enrolled in a drug plan from the time she was 65 to 85. That's a true story. So you don't want to be that person. So the penalty is calculated by taking 1% of the national base beneficiary premium, and that's like $36, not 0 or 15 or 30. It's a bigger number. It's the national base premium, multiplying that by the number of months since the person became eligible and didn't have coverage. And so it can be, a little chunk. So here's an example how that might break down. Tammy, who waited 2 years, 24 months after first becoming eligible, she chose a plan premium after 2 years of $20.90 a month. So the base national premium in 2025
26.
26 is 38. My sidekick here is telling me that should be 26. We'll fix that. $38.99, and that's 1% of the national base. So that's 39 cents. Then 39 cents times 24 months equals $9.36. She has to pay that late enrollment penalty plus her monthly insurance premium, $20.90, which could change, but she's got to pay that $9.36 for the rest of her life. And $9 isn't a lot, but my 20-year lady, hers is pretty big. So for her, for Tammy here in the example, that's an additional $112.29 per year that could have been avoided. So I can only, lead a horse to water here, but I try my best. So just so you know. So I talked a little bit about throughout the talk about valuing choice and that there were better Medicare supplements out there, but truly there is finally a better medical supplement. And through an independent advisor, you can, you're not going to get this by going to any particular company, but by going to an independent advisor that has such a contract. But just, I'm telling you, there's one Medicare supplement, and this is product neutral talk here. I'm not talking about, not advertising companies, nor myself. This is educational, but there's only one Medicare supplement that offers preventive or wellness benefits that are not covered by Medicare. It covers early detection screenings, all these emerging technologies I was talking about. It will cover all that. It'll cover more frequent colonoscopies rather than wait 10 years. It would cover more frequent mammography if you wanted more frequently one. It would cover lifeline screenings and things like thermography. So you can, they also have a patented innovative G plan. It is patented till 2036, and it has a 25 to 35% lower premium than G. And it's got really great long-term value because it has a high deductible, but just for a short period of time. And then that goes away and the premium stays lower than the G. It makes a lot of sense. You can stay active. There's a free fitness club membership in there. You can choose any doctor or hospital accepting Medicare. This is a traditional Medicare supplement. It just happens to be a special one with a rider that they came out with 10 years ago and nobody else has come out with it. And it's awesome. No referrals are needed. If you're a snowbird or travelant, you go anywhere in the US with no network restrictions, just like a traditional plan. And it is. The company's been around since the early 1900s, and no one has really, through my office, enrolled in anything but since we became affiliated with this. So next slide, please. So what do you do now? Well, everybody's got different needs. If you're 64, you should put a meeting on the calendar with somebody, preferably someone independent, so you're not just looking at one thing. There's not just one thing to consider, there's multiple things. But someone who has expertise in Medicare supplement and long-term care planning, because long-term care isn't covered by Medicare. So you should be talking about that at the same time. It's a good time to think about that. I'd rather have people talk about it when they're 50, but if they don't, they slip through the channel there. What we want is to have long-term care plans in place before a crisis, not afterwards. And if you have that crisis, of course, what do? You call Elderwerks. So if you're already enrolled in a supplement or a Medicare Advantage plan, you may be in that get out of jail time, or if you have good health, you may be able to change plans anyway. And by the way, there is one company that doesn't ask medical questions, even if you're beyond your get out of jail time. So there is actually something for everyone if you're talking to someone that's independent and has all these companies available. Open enrollment happens October 15th through December 7th, but that is really, once you have a traditional supplement, I don't care about those dates anymore. Those mean nothing. Those mean nothing to you except at the time when every January, if you want to check and see if there's a better drug plan for you that covers your needs better, or that might be lower in cost if yours is not one of the zero cost ones. But open enrollment doesn't mean anything to people who are on a traditional Medicare supplement, because the plan that you enrolled in does not need to be re-enrolled in every year. It just continues to enroll. Yes, rates are going to change. They're going to change with everything. They change with our birthdays. They change with inflation, but you don't need to do anything. So during that period of time, for those who it does mean something to, you can drop or switch the Medicare Advantage plan to change Part D, or switch back to original Medicare. Medicare Advantage plans do go by the calendar, so that's the time for them. But on a traditional plan, this open enrollment period doesn't mean anything. Again, 80-20 rule, Medicare is paying 80%, our supplement's paying 20, we've got a small deductible, and then no out-of-pocket for anything else. Reminder to call someone for global travel coverage if you leave the country. I don't care if you go to Mexico. I wish you wouldn't go to Mexico. That's considered a war zone. But if you go to Mexico, even for 5 days, you buy it just for the number of days that you have it, and pay based upon your zip code, where you're going, and your age. So it's different, for every situation. So what's on your mind? If you have anything else on your mind, let's go into some questions now. You can schedule an optional free 30-minute strategy conversation with my office if you'd like to, for pre-screening for a plan to see what works for you. You can call or text.